Do you have elbow pain when you turn a door handle, lift a kettle, operate a power tool, or use a screwdriver? Are you frustrated that your Achilles tendon pain limits your running and training? Do you have heel pain or plantar fasciitis after a long walk in the Peak District? Do you have shoulder pain when you reach up to pick up something from a high shelf? Are you concerned that your tennis or golfer's elbow is not getting better and you face the prospect of pain-killing injections? Many of these conditions are especially difficult to resolve. For this reason, we invested in cutting-edge revolutionary shockwave technology at both our clinics. We have made this decision because there's a growing body of good clinical evidence to support this technology. This is consistent with our mandate to offer patients the best possible treatment outcomes, using treatment modalities supported by the best clinical evidence. So, how does shockwave therapy work? Compressed air drives the projectile up to 80 to 90 kilometers per hour within a guiding tube that strikes a metal applicator placed on the patient's skin. The kinetic energy is converted into a radial shock wave. The projectile generates stress waves in the applicator that transmits pressure waves into a tissue to a depth of 4 to 5 centimeters. The shock waves pass through the skin to the injured part of your body. Shockwave works by increasing blood flow to the injured area, stimulating cell regeneration and healing and decreasing local factors, which can cause pain. Shockwave is effective for all common tendon problems, such as tennis elbow, golfer's elbow, shoulder tendons, patella tendons, Achilles tendons, tibial stress syndrome or shin splints, plantar fasciitis, hip pain such as trochanteric bursitis or calcification of hip tendons. Consultations can be booked online at a time to suit you. You can also ring us on 01298 214 994. Our online brochure is also available for you to download. Or if you have any questions, please feel free to fill out our inquiry form.